We can actually start providing dental care for children whilst they're in the womb. Yes, you heard me, whilst they're in the womb. In that mothers, I'm sure all listeners will be familiar, particularly those who have children, are quite familiar with taking multivitamins on a regular basis during pregnancy in order to supplement and make sure that the growth of the child and everything is in good shape. In Europe, it is very, very standard to include in those multivitamins fluoride. And the fluoride that the pregnant mother is ingesting is to provide fluoride to the fetus whilst it's growing, and that fluoride is picked up by the teeth that are developing whilst the child is still in the womb. Shortly after birth, there's so many other issues going on. The last thing on your mind, obviously, is dentistry. Of course, it could be the first thing on your mind if your child is actually born with 1 or 2 baby teeth. As you can imagine, that would make breastfeeding rather tricky.
How does that happen?
Well, the eruption of teeth begins typically at the age of 6 months. When you look at the eruption schedules of baby teeth and permanent teeth, always plus or minus 6 months to 1 year. And so subsequently, at birth, it is indeed possible to have a baby with an erupted or 2 erupted lower teeth. It's always the lower ones that come through first, followed by the opposing teeth on the upper. And so teeth begin to erupt from 6 years on, and we want to ensure, and then of course those teeth then are susceptible to the oral environment. The baby teeth come into the mouth from age 6, and they begin to drop out by age 6. Now, what else is happening? During that time, your whole body is growing during these tender ages. I mean, the amount of growth that we do between the ages of birth and age 6 is absolutely massive. And so the same teeth are obviously not going to be functional. They're also not designed to last long term. They have very short roots and very curved roots, and they're basically holding the space and creating the pathway for the permanent teeth to ultimately follow. So now, if we lose a baby tooth at, let's say, age 5, 6, 7, 8, we're suddenly going to be left with a gap. It's not as if we wake up tomorrow and, there's a permanent tooth just sprouted into place. It depends on the age. And sometimes if I have a tooth that I know is going to naturally be lost within the next few months, I'm obviously not going to fill it. I would probably elect to leave it even if it's damaged, or I would indeed remove the tooth if it was causing symptoms, i.e. pain or bleeding or discomfort, or if it was very unsightly, and if it was going to be lost, fine. But if it is there, and it is, and I know that if I remove this tooth, I won't be seeing a permanent tooth underneath for several years. What will happen then is I will have a gap, and if I have a gap, so the permanent teeth, which in most cases are a little bit crowded, they will get very crowded. And so therefore, thus, the potential need for braces, which we'll probably touch on later on. Early loss of baby teeth is far more likely to result in crowding and indeed lack of function. Another very important thing is, as I was saying, the baby teeth have roots, and it holds the space. Well, if you have roots sitting in the jaws, it makes the bone that it sits in a little bit softer. So when the baby teeth are shed naturally, the adult teeth underneath have a much softer area of bone and jaw to move through. If you're having a checkup yourself, certainly bring your kids in. Bring the kids in for a checkup. You want them to get accustomed to the faces, the uniforms, the environment. If we do proper dentistry, as in if we observe and if we consult frequently and we clean, which technically isn't treatment, it's more advice and consultation. I suppose cleaning is a form of treatment, but I would see it more as maintenance than treatment. If we do that early, you can absolutely ensure that your kids never ever actually need a dentist for dental treatment. Now, if I'm seeing them for the first time and they're in pain, I've got a problem, because this kid is if they're in pain, it's likely that I'm going to require an anesthetic. I'm going to have to do maybe some drilling, or worst case scenario, I might have to remove a tooth. This is not a good start. That's not a good thing to be doing for the first time. And not only that, the worst thing, and I hear this so often, is parents, in an effort to try to make their kids behave at the dentist, will tell them, Johnny, behave yourself or I'll get the dentist to pull your teeth out. Or I'll get the dentist to give you an injection. So that means you're saying, as a threat, as a punishment, I'm going to get the dentist to treat you. And now, of course, you look at me now, say, okay, doc, go ahead and treat my child. I've already conditioned him that this is effectively a form of punishment. Now you go ahead and treat him. By the way, he hasn't slept and he's in pain and he needs fixing now. Thank you very much. The purpose of braces and the speciality in dentistry is called orthodontics, from the Greek word ortho, perfect, dontics, teeth, perfect teeth. And the purpose of it is that the observation is that 75% of all human beings, if without any intervention whatsoever, will end up with crooked teeth. Now, is that a terrible thing? If they're clean, if they're healthy? No, it's not. It's very rare that crooked or crowded teeth actually will cause malfunction or gum disease, or it will result in a greater likelihood of gum disease if your teeth are very crowded because you can't clean so well. But the fact of the matter is that orthodontics is an early intervention procedure, usually an early intervention procedure to ensure that you end up with straight, nice-looking, healthy teeth. I mean, some people think it's terrible vanity to have all cosmetic procedures done and whatnot. I don't see it as that at all. And these days, we can make the braces all very pretty. We can put these multicolored bands around them, and you can put the colors of the Antigua flag or whichever.
In other words, it can be cool to have braces.
Absolutely.
In.
Middle school is cool with braces for sure. Invisalign is a classic thing. Invisalign is a very, very, very interesting new age product, and what Invisalign does is that rather than having brackets and wires glued to the surface of your teeth permanently meaning for about 2.5 to 3 years, you take molds of the teeth and you run it through a CAD-CAM machine. What that basically means is you create a digital image of the mouth. So the models are sent to a special lab in California. Invisalign is based in California. And that lab, they scan the teeth, and so now they have a digital model of your teeth. Onto that digital model, they then do a vacuum-formed suck down of this very thin, clear plastic shell, which when it's in place is invisible. But that thin, clear plastic shell has, you see, digitally they move the teeth on the computer, and then they create a plastic shell to create that movement. And that is done in something like as many as 20 to 40 different stages over a period of 2 years. So it still takes time, but the advantage is that you don't have to have the braces in all the time. It doesn't look as if you have, doesn't look like you're having any treatment at all. It's very effective, but it has limitations. It's very difficult with Invisalign to completely derotate teeth. It's very difficult to get massive movements. I'm not saying impossible, because, again, it's computer-based technology. It's improving as we speak. It's improving. I mean, that's how fast things are going these days. But still, at the end of the day, it is very, very difficult to get perfect results in all cases. In mild to moderate cases, Invisalign is a well worth consideration. But there's another limitation of Invisalign, which you must be warned of, is that it is not recommended for children. And it's not recommended for children simply because of compliance. Meaning, if I give your 12-year-old an appliance that he or she can take out and does not have to wear, they will not wear it. I don't care how good you think your kid is, they will not wear it all the time that they're supposed to. And when we do this scanning on the computer, when the lab in California does the scanning on the computer and provides all 20, 30 appliances, that's it. You skip one, you've spoiled everything.
I have a 3-year-old that does not like to brush his teeth. What can I do to make it easier?
Brush his teeth for him.
Oh.
No two ways about it. 3 is a critical time, a critical age that you enforce habits. Make a game out of it. As in, this is going to happen whether you like it or not, and we're going to have fun doing it. But it's not a negotiation. This is what is going to happen, and you're going to brush your teeth. And if you don't do it yourself, I will do it for you. And that applies to your 8 and 9 and 10-year-old. Stand behind them. Put your hand under their chin and gently get them to bite their teeth together and scrub in and out Don't worry about this rotating stuff at this point. Just scrub in and out, backwards and forwards on both sides of the teeth, then on the surface of the teeth, and gently on the inside. Be very careful if you ram a toothbrush down next to somebody's tongue. It can be very unpleasant and very uncomfortable. Do not make the mistake of tilting your child's head up to face yours as you're brushing their teeth. They will gag, they will choke. That's not going to work. You're causing more harm than good. Allow the child's face to lean forward over the sink and gently put the toothbrush in there.
Want to find out if the doc makes adult dentures?
Absolutely, that's the only dentures we do make. We don't. Dentures are for adults, and yes, we do. That's the simplest form of tooth replacement. We've talked about that in the show before. The answer is yes. We work with a lab. Sometimes we work with a lab here in Antigua. Sometimes we work with a lab overseas. It just really depends on the circumstances, the needs, and the demands of the patient. We have to look at our teeth not like we look at fingernails or our hair. Teeth are literally part of our health. Teeth, unlike fingernails, can actually affect the rest of your body. We absolutely need our teeth every day. Every single day of our life, we certainly do need teeth, or we do need the ability to chew and to function and thus ensure a nutritious, healthy diet. That goes without saying. But if teeth are not cared for, and even if you think you have good teeth, and if teeth are not cared for, you can get one of two major diseases that almost everybody on the planet has had at least some experience of, is that you can get the formation of diseased gums, gingivitis, which can lead to gum disease, which is periodontal disease. You have to go for your consultation. You have to go for your visit. You have to see what's going on. If you haven't been for a while, your dentist has to take x-rays. X-rays will show us what levels your bone are. X-rays are diagnostic for the two diseases we've talked about. The diagnostic as to whether you have dental decay. We can see it clearly on an x-ray. When we can't see it in the mouth, often we can. X-rays are indicative of the bone levels around the teeth. When we certainly can't see bone. When I look on your mouth, I can't see bone. But I know the bone is around the teeth. I need to see what level that bone is. I can't do that without x-rays. So we need to take a couple of x-rays, a couple of standard x-rays and check. Then it will become very obvious. And here's the thing about it, is that the reason that there is so much dental disease, i.e. either gum disease or dental decay, is because it doesn't hurt for quite some time. You've already bypassed a whole opportunity of fixing and treating that condition easily, inexpensively, and what we call atraumatically. Now when you have toothache, we've got to get inside that tooth or around the tooth or get rid of it. So visit your dentist regularly, at least twice a year. Have x-rays taken approximately once a year, depending on circumstances. Sometimes more, sometimes it doesn't have to be that frequent. Every other year can also work depending on circumstances. Your dentist will advise accordingly. Brush every day, twice a day. No exceptions. You must brush your teeth. Your teeth do not clean themselves. Your feet don't clean themselves. Your body doesn't clean itself, with the exception of your ears, which are self-cleansing, as ear, nose, and throat surgeon would remind me. But your body is not self-cleansing, and your teeth are certainly not self-cleansing. Your mouth is in a warm, moist environment, which is absolutely perfect for growing bacteria. Ideally, I would love to think that you're brushing your teeth after lunch just quickly, even if you did it without toothpaste. That's for the midday brush. If you brush your teeth with water and a toothbrush right after lunch, you're already way ahead of the game. And reduce those sugary snacks. Sugar is bug food. Sugar feeds the bacteria that are alive in your mouth. Come see us. Have things checked out. There's many things that we can do to enhance your smiles. We can do cleaning. We can replace missing teeth. We can do tooth-colored fillings. We can repair damaged or broken teeth. And don't leave big holes in your teeth unattended, even if they don't hurt. It harbors more bacteria. It catches food. It rots food in there. Obvious problems resulting from that. You can have your teeth bleached or bonded or recontoured to enhance that smile for 2012.